Ladies and gentlemen, dear friends, it's my privilege to welcome you to this evening's symposium, a dinner conversation we call it, the subject of great innovators and innovations in congenital and pediatric cardiac care, sponsored and presented by Johns Hopkins All Children's Hospital. My name is Marshall Jacobs, and I was once a congenital heart surgeon. Tonight's symposium reflects the ongoing collaboration between the Pediatric Cardiology and Cardiac Surgery programs at Johns Hopkins Hospital and School of Medicine in Baltimore, and our colleagues at Johns Hopkins All Children's Hospital in St. Petersburg, Florida, who are your hosts. This collaboration between the two sites got started in 2011 when the All Children's Hospital, long established in St. Petersburg, Florida, became part of the Johns Hopkins Health System. The following year saw the establishment of Johns Hopkins Children's Heart Surgery, a clinical and educational collaborative that comprises the pediatric cardiac surgery programs in Baltimore at the Johns Hopkins Hospital, in St. Petersburg at Johns Hopkins All Children's Hospital, and at Florida Hospital for Children in Orlando. I've had the privilege of being part of the Johns Hopkins faculty for the last 4 years. In Baltimore, at the Helen Taussig Heart Program, I have the pleasure of serving with cardiac surgeons Dr. Luca Vercella, who's the Director of Pediatric and Congenital Heart Surgery, and Dr. Narutoshi Habino, and we enjoy the privilege and pleasure of collaborating with the cardiology staff of the Taussig Heart Center, 15 strong, along with dedicated cardiac intensivists, anesthesiologists, nursing specialists, scientists, and all of the other ingredients that go into a multidisciplinary congenital heart program. We perform about 300 pediatric cardiac surgeries per year in Baltimore, in addition to a lot of adult congenital heart surgery, and provide care in a continuum that begins in the fetal period and continues into adulthood for patients with congenital heart disease. We consult regularly and communicate and collaborate regularly with our colleagues in St. Petersburg. I've had the pleasure to join them in participating in educational programs for families, patients, and healthcare professionals. Our programs work together closely to make clinical advancements, to cooperate in outcomes research, and I hope you'll glean some insights tonight through these important conversations about innovation in our field. I really am very privileged to welcome you. People often ask me, are Jeff Jacobs and I cousins? And I'll leave that an unanswered question. We're very close, and I'm really standing in for Jeff, who's unable to be here tonight because he's home operating in St. Petersburg. So I hope that I will uphold the tremendous standard of hospitality and education that Jeff ordinarily represents. And with those comments, it's my great pleasure to introduce Dr. Gary Stapleton, Jeff's co-director of the Johns Hopkins All Children's Heart Institute. Gary.